Hey, you. If you're anything like me, seeing your dog uncomfortable, maybe, limping after a good run or just seeming a little off,
Oh, it's tough.
you just want to wave a magic wand, take that pain away, right?
Totally.
Well, that's what we're digging into today. Really effective ways to manage pain for our furry family members.
Mm-hmm.
We've got a helpful blog post as our guide, one that outlines some pretty solid techniques for dog pain management.
Yeah, it looks like a good overview.
Our goal here, our mission for this deep dive,
Mm-hmm.
is for you to come away not just knowing that your dog might be hurting, but really understanding how pain works in them and what practical steps you can actually take to help them feel their best.
Exactly. It's about moving beyond just, noticing a whimper to understanding the bigger picture of what's going on and what your options are.
Right.
What's really key to grasp, I think, is that managing a dog's pain isn't just treating a symptom. It's really about tackling a complex issue that affects their whole health and well-being.
Okay, so the blog post kicks things off by explaining that dog pain isn't just one monolithic thing. It can be acute,
Right.
like when they maybe pull a muscle chasing a squirrel,
Yeah.
or it can be chronic, something that builds over time with the conditions like arthritis.
That's a crucial distinction. Yeah. Think of acute pain as that sudden alarm system,
Right.
signaling immediate injury.
Okay.
Chronic pain, though, that's more like a persistent background noise, often from ongoing conditions.
Mhm.
And what's important to realize is that pain signals, they travel through specific nerve pathways up to the brain. And factors like a dog's age. Older dogs can be more susceptible.
Yeah.
Their breed, because some breeds have predispositions to joint issues, right?
Mm.
And just their general health, it all plays a role in how they experience and handle that pain.
And it's more than just physical discomfort, isn't it? The blog post mentions how long-lasting pain can actually affect their mood and behavior. It could lead to anxiety or even what looks like depression in dogs.
Precisely. Yeah, if you think about how chronic pain affects us humans, we can start to imagine what our dogs might be going through. Constant discomfort can definitely lead to frustration, maybe withdrawal, less interest in things they usually love. So managing their pain effectively isn't just about the physical side. It's vital for their mental and emotional health, too.
Yeah.
A happier dog, a less painful dog, is usually a more engaged dog,
Okay, so how do we even figure out if our dogs are hurting? The blog post mentions dogs can be like real troopers
Oh, absolutely.
and not always show obvious signs. What are some of the more subtle clues we should be watching for?
That's a really important point. Because
Yeah.
they can't just tell us, right?
Right.
We need to become sort of detectives, observing changes in their behavior. For instance, a dog that's usually bouncing off the walls might suddenly get quieter, more withdrawn,
All
or
right.
maybe just less enthusiastic about their favorite things like walks or playtime. Sometimes pain can even show up as increased irritability or even aggression if you touch a sensitive spot.
That rings a bell. I remember a friend's dog usually loved belly rubs, but when his back was bothering him, he'd snap if you went near that area.
Exactly that kind of thing.
The blog post also mentions the more obvious physical signs, like limping or seeming stiff.
Yes, exactly. A limp is pretty clear, but even subtle changes in how they walk, like a shorter stride, or maybe they hesitate to put weight on one leg, that can be a sign.
Mm-hmm.
Watch for difficulty with everyday stuff, like getting up from lying down, struggling on stairs, or being reluctant to jump onto the sofa when they normally would.
Yeah.
Changes in posture can also be telling, like an arched back, a tucked tail, or always favoring one side. That could indicate discomfort.
Okay.
And some dogs will focus right on the source of the pain, excessively licking, chewing, or biting at a specific spot.
And there are other little things too, right? Like changes in how much they're eating,
Appetite changes.
or maybe panting more than usual even when they haven't been running around, or seeming restless, especially at night.
Absolutely.
Yeah.
Any noticeable, persistent shift in their normal routines and behaviors should really raise a red flag.
Okay.
And here's a really helpful tip from the blog post. Keep a simple journal.
Oh, smart.
Yeah, just jot down when you notice these changes, what was happening. This log can be incredibly valuable when you talk to your vet. It gives them a clear timeline and concrete examples.
That makes total sense.
Okay.
And that leads us straight to what the blog post really emphasizes as crucial, talking to your vet.
Yes, absolutely.
It stresses that we shouldn't try to diagnose or treat our dog's pain on our own.
That's paramount 100%. While we can observe our dogs and have our suspicions right, a veterinarian has the expertise to pinpoint the actual underlying cause. They'll do a thorough physical exam, review the dog's medical history, and they can order specific diagnostic tests. Things like x-rays to look at bones or joints, blood tests to check for inflammation or infection, maybe even more advanced imaging like an MRI in some cases to get a really detailed picture.
And they can guide us through the treatment options too, explaining what's available and the potential, pros and cons of each. The blog post reminds us that some medications can have side effects.
Definitely.
Or might not interact well with other meds the dog is already on.
Exactly. Your vet can explain how to safely give any prescribed medications and will monitor your dog's response. Make sure the treatment's working and not causing problems.
Right.
They can also talk about other therapies, lifestyle adjustments, things that might help. A key takeaway here is that pain management isn't one size fits all. What works great for one dog might not be right for another.
Makes sense.
So developing that tailored plan with your vet is essential. And regular follow-ups too. That's crucial to check progress and make adjustments as needed.
Okay. The blog post then goes into some of the more common reasons why dogs experience pain. Arthritis is a big one, isn't it?
Yeah.
Especially as our dogs get older.
Yes, osteoarthritis or degenerative joint disease. It's incredibly common, particularly in senior dogs, like you said, and also in larger breeds that naturally put more stress on their joints. It's basically a progressive wearing down of the cartilage in the joints that leads to inflammation, stiffness, and pain.
Yeah.
And the blog post correctly points out that dogs carrying extra weight are at a significantly higher risk because of all that added pressure on their joints.
We also see a lot of injuries and trauma, don't we? From those unexpected tumbles to just enthusiastic playtime.
Absolutely. Sprains, strains, even fractures can happen from accidents or just overdoing it during exercise. And we can't forget post-operative pain after any surgery. Good pain management after an operation is so important for a comfortable, speedy recovery.
Right.
Even things that seem minor, like infections, maybe dental issues in the mouth, or skin infections, they can be surprisingly painful for dogs.
The blog post also brings up chronic conditions like hip dysplasia and intervertebral disc disease. Mentioning these can sometimes run in families.
That's right. These are often long-term conditions that can cause persistent pain and mobility problems. Knowing there might be a genetic link can sometimes help with earlier diagnosis and, proactive management.
Okay.
And sadly, we also have to consider more serious conditions like cancer and tumors. They can cause pain either directly by pressing on nerves or organs, or indirectly through other changes in the body.
Wow, it's quite a range of potential causes. And as the blog post highlights, understanding these can really help us be more aware, maybe even take preventative steps.
Exactly.
Like keeping our dogs at a healthy weight and making sure they get appropriate exercise, nothing too strenuous.
Exactly. By being informed about these common culprits, you're just better equipped to recognize when something might be wrong and have more productive conversations with your vet about prevention and early intervention.
Okay, now let's dive into the actual ways we can help our dogs when they are in pain. Medication is often a key part, and the blog post starts with NSAIDs, non-steroidal anti-inflammatory drugs.
Right, NSAIDs. They're frequently prescribed, and they can be very effective at reducing both inflammation and pain, especially for things like arthritis and post-op discomfort.
Okay.
What's really important for people to understand is how they work. They block specific enzymes in the body that contribute to inflammation. But, and this is a big but, because they can have potential side effects, especially with long-term use, things like stomach upset or kidney issues, they must always be given under strict veterinary guidance.
Always vet guidance, got it.
Yes. Your vet will figure out the safest, most effective type, the right dose, how long to give it, all based on your specific dog. And regular monitoring, maybe blood tests might be needed too.
Then there are opioids, which the blog post says are for more significant pain. It lists examples like tramadol, buprenorphine, fentanyl.
Yeah, opioids work differently. They bind to specific receptors in the brain and spinal cord, effectively blocking the perception of pain.
Oh.
They can be really powerful tools for managing moderate to severe pain, especially right after surgery or with acute injuries.
But side effects.
But yes, they also carry a risk of side effects. Things like sedation, constipation, sometimes even respiratory depression. So their use needs careful thought, precise dosing, and close vet monitoring.
Right.
It's also worth noting different opioids have different strengths. Tramadol might be for more moderate pain, while something like fentanyl is usually for more severe acute situations. Very controlled use.
It's good to know about other types too, like gabapentin for nerve pain and amantadine for chronic pain. The blog post mentions those.
Yeah, these meds work through different pathways. Gabapentin, for instance, seems to affect calcium channels in nerve cells, which can help calm down overactive nerves. Good for neuropathic pain, that burning, tingling kind.
Okay.
Amantadine, on the other hand, can help sort of modulate chronic pain signals in the central nervous system. What's interesting is that sometimes these are used with NSAIDs or opioids.
Ah, combination therapy.
Exactly, to provide more comprehensive relief targeting different aspects of the pain.
Right. Okay, moving beyond meds, the blog post explores alternative therapies. Acupuncture is one that's, well, ancient.
Acupuncture, yeah, from traditional Chinese medicine. It involves inserting superfine needles into specific points on the body. The idea is it might stimulate the release of endorphins, natural pain relievers, and maybe modulate nerve signals too. A lot of dogs actually respond really well.
Really?
Yeah, showing reduced pain, better mobility, especially with things like arthritis and hip dysplasia. Definitely worth discussing with your vet if it might be an option.
Interesting. Chiropractic care is another one mentioned, focusing on manual adjustments.
Chiropractic care aims to restore proper alignment and function of the musculoskeletal system. That can help alleviate pain and improve mobility, potentially beneficial for conditions like IVDD or certain joint injuries. But the blog post rightly emphasizes it's critical to find a qualified and licensed veterinary chiropractor, someone specifically trained in animal anatomy, not just a human chiropractor.
Good point. Very important distinction. And then there's massage therapy, which just sounds like it could be really soothing.
Oh, absolutely. Therapeutic massage can help relax tense muscles, improve blood circulation, promote overall relaxation. It can be great for dogs with chronic pain, those recovering from procedures, or even just general stiffness.
Nice.
Plus, it's a wonderful way to bond with your dog and really become more aware of their body, any tender spots.
Yeah, definitely. The blog post also highlights how important diet and nutrition are, especially for joint health and weight management.
Oh, the connection is huge. What our dogs eat, their weight, their joint health, it's all linked. Keeping them at a healthy weight is just crucial.
Reduces the strain.
Exactly. Reduces the stress on their joints. So important for managing arthritis and preventing more wear and tear. The article also rightly points out omega-3 fatty acids, like from fish oil.
Anti-inflammatory.
Yes, they have anti-inflammatory properties that can help reduce joint pain and stiffness. Good stuff.
And supplements like glucosamine and chondroitin. The blog mentions those for cartilage support.
Yeah, those supplements can help support the structure of the cartilage, maybe improve joint lubrication and mobility, especially helpful for dogs with those degenerative joint conditions.
Okay.
The post also suggests antioxidant-rich foods like berries, leafy greens. They can help combat overall inflammation in the body.
Good tips.
And as the article wisely advises, talk to your vet or a board-certified veterinary nutritionist. They can help you create a diet plan tailored specifically for your dog's needs.
Right. Tailored plan. Okay. Physical therapy and rehabilitation also get good coverage in the blog post. Sounds really important, especially post-surgery or for ongoing issues.
They are indeed vital, yeah. Physical therapy aims to improve mobility, build strength back in weakened muscles, and reduce pain through customized exercises and different therapies.
Like hydrotherapy.
Exactly. Hydrotherapy, water therapy, often using an underwater treadmill. It's fantastic for dogs with joint pain because the water's buoyancy reduces the weight on their joints. But they can still exercise and build muscle strength and range of motion. Really beneficial.
And laser therapy is mentioned too, using low-level lasers. Sounds futuristic.
It does a bit, doesn't it? But it's a non-invasive treatment using specific light wavelengths to stimulate healing at the cellular level.
Okay.
It can help reduce inflammation, improve circulation, speed up tissue repair. So it's a valuable tool for managing different kinds of pain and helping recovery.
Wow.
The post also highlights therapeutic exercises, controlled walking, stretching, balance exercises. A qualified veterinary physical therapist can teach you how to do these safely with your dog.
Okay, that's good to know.
Yeah.
Finally, the blog post touches on some simple things we can do right at home for mild relief and comfort.
Yeah, and these home remedies can often add significant comfort alongside other treatments, Warm compresses.
How do you do that safely?
Just like the article says, a warm, damp towel, not too hot, can help relax tight muscles, reduce stiffness, improve blood flow. Cold therapy, like an ice pack wrapped in a towel, is great for reducing inflammation and numbing pain, especially for acute injuries. Just make sure there's always a barrier between the cold pack and the skin.
Right, protect the skin.
And ensuring your dog has a comfy, supportive resting place, maybe an orthopedic bed designed to cushion their joints. That can make a huge difference, especially for arthritic dogs.
Yeah, my old dog loved his orthopedic bed.
They really can help. And even small things, like elevating their food and water bowls, can reduce strain on their neck and back. Particularly helpful for older dogs or those with spinal issues.
Simple but effective ideas. So if we bring it all together, it really sounds like managing dog pain effectively it's a multifaceted approach.
It really is.
It's about being observant, partnering closely with your vet for diagnosis and a tailored plan,
Mm-hmm.
which might involve meds, maybe alternative therapies, diet changes, physical rehab, and even some thoughtful things we do at home.
That's a perfect summary.
Yeah.
By being proactive, staying informed, and working closely with your vet, you really can significantly enhance your dog's comfort and their overall quality of life.
Yeah.
It's definitely an ongoing process, though. Observation, communication with the vet, making sure that pain management plan keeps meeting their needs as things change.
It really makes you think, doesn't it, about how deeply connected our dog's physical well-being is to their emotional happiness.
Mm.
It's not just about making the ouchie go away.
No, not at all.
It's about supporting their whole health, their whole being, so they can keep enjoying their lives as much as possible. What a responsibility, but also what a privilege to be able to help them like this.